So welcome to Wellness Wednesday. I am here with Dr. Afrooz. Yay, I'm so happy to have her. So she was a couple minutes late only because, she's a doctor. Life is busy. So thank you so much for being here with us. It's good to see you again. I haven't seen you face to face for a few years since I was sitting on the other side of your desk as your patient.
Yeah, good to see you too.
Good to see you. So I'm going to read a little bit about Dr. Afrooz so you can get to know her a little. Sultana Afrooz is a holistic and integrative medicine physician at Be the Change Health and Wellness, located in Columbia, Maryland. Dr. Afrooz specializes in diagnosing and treating highly complex health challenges, confronting many patients and providing them with the in-depth, compassionate, and individualized care they deserve. Dr. Afrooz has practiced osteopathic medicine since receiving her doctorate from Des Moines University, Osteopathic Medicine Center in Des Moines, Iowa in 2002. She specializes in treating patients who have been chronically ill from the effects of tick-borne infection, mold toxicity, and environmental toxicity. Dr. Afrooz uses an integrative approach to treatment using prescription antimicrobials, herbal supplements, and nutritional supplements. She has an exceptional knowledge of mind-body medicine, food as medicine, and other integrative functional approaches to health and healing. Dr. Afrooz is dedicated to helping her patients achieve wellness and healing in all aspects of their lives. She believes that the body has an inherent ability to heal itself, and it is her goal as a practitioner to guide patients in their journey to healing. Dr. Afrooz has had extensive training in the treatment of tick-borne infections and has attended annual ILADS conferences to keep up to date in the latest research and treatments in tick-borne infections and multiple infectious disease syndrome. With this training, she has become extremely involved in learning about the systemic effects of mold toxicity and treating the chronic systemic effects of mold illness. Dr. Afrooz has also spent years studying the various methods of persistence in chronic infections. So that's long, and I shortened that bio because it's even longer. So now we get to go beyond the bio and get to know you a little bit. So I know you because you treated both my daughter and I, but I think it's important for the local community, but also the broader community to know that you exist and doctors like you exist. So would you mind sharing what led you first into pursuing medicine, and then what took you to move toward a more functional and integrative approach?
So before I went to med school, I actually was looking at allopathic and osteopathic. And so when I saw that in osteopathic medicine, there was a focus on the body having an inherent ability to heal, and also that the structure of the body affects the function and the function affects the structure, I decided to go to osteopathic school, medical school. And then when I was there, we learned a lot of like manipulative treatment techniques for a lot of different like skeletal dysfunctions, or even actual like medical diagnoses. So I was already like looking at the body as a whole, but when I graduated and I was working in the clinics, it seemed as if I wasn't really healing anything. Most of the time I was giving a medicine and the patient had to take it for the rest of their lives or for as long as I was around them. And then a lot of patients were coming back to me with problems, and all I could do was send them to a specialist, but they never got relief. So I prayed a lot about it because I in our religion, there's a saying from the prophet that says every disease has a cure. So I was praying like, I know every disease has a cure, so help me find it. So actually my supervisor at that time, she got this conference. It was on her desk. It was from Scripps Integrative Medicine Center. And it's the first and only time that they've ever been on the East Coast. It's like a week-long conference. I like scrimped and saved every dollar I had because that clinic wasn't paying me a lot at that time to go to the conference. And then when I went there, that kind of changed my life because I saw that there was integrative neurology, integrative GI, integrative pediatrics, integrative psych, integrative cardiology, and they were using like supplements, lifestyle change, herbals, to help the patients. So that was like 2009. So I've been pretty much doing integrative medicine for 10 years. And the first year, I just kept trying to mentor and find somebody who would teach me, because there was a lot to learn. So I ended up working with Dr. Fishman. He was already doing integrative medicine for probably like 10, 15 years. And he mentored me, and I worked in his practice for 4.5 years. And then my commute was really long. So it was like an hour and 10 each way. So I got tired. So then I worked in a few other practices trying to coexist. And then I just did my own, because sometimes it's hard. A lot of the admin, having staff and all these things, a lot of those kind of things. I wanted staff who would be more empathetic to the patients and, kind of understanding. And it's not easy to find it. And it's hard because what we're treating is not just like a cold or, like a sinus infection. It's way more, and the patient's entire lives are affected. So it's hard to find the right people. But at least if I have my own practice, I can, kind of have more say on that. So yeah, so I mean, and I feel like when I started doing integrative medicine that I was making a bigger difference, and every year I find something else that I didn't know the year before that makes me like better at kind of understanding the whole picture. So
Right. Yeah, I think the first time I saw you, we drove to Virginia. So I was really glad when you came to Maryland, I didn't have to drive as far to see you.
Yeah.
Yeah. So I was super happy that you opened an office closer. Yeah. And I'm sure that you played a role in my journey into studying functional medicine, because I have MS and then got Lyme, and my mom died with dementia. So I'm always hoping and looking for a root cause to, it's not just a medicine that's going to solve a problem. So I really have appreciated your approach, and glad that you exist and people like you exist. So thank you for all the work that you're doing, and the ongoing effort that you put into the continuing education, like you said, as new information is always coming out. So there's Dr. Afrooz, the doctor. Are you willing to share anything about Dr. Afrooz outside of those four walls of your office?
You mean my family that never sees me? Yeah. So I'm a mother of 7, and I actually became a grandmother. So since I saw you, I have a granddaughter that's 8 months old and another one that's 4 months old.
Congratulations. Yeah. Oh my gosh. I did
Yeah.
not know that about you. I can't believe that's possible.
Yeah. So, I mean, my kids don't see me a lot because once you start treating Lyme disease, like it takes over. And it's hard because your patients, nobody knows them. So, nobody knows everything about them and understands the symptoms they're having. So it's hard to have someone else, take care of them. Like I have a really hard time trying to figure out how to train my other staff members to take care of them, because I feel like, okay, they don't know them and now they're coming in the middle, and will they really be able to understand what's going on? So it's kind of tough, but for my family, my family is really important to me, and I want to spend more time with my children. So I've been trying to put together a team and have a system and have more people in my practice. I'm still working on that because it seems like every time I have a person, after 2 years, I don't have them, and it's hard. But I've learned, so now that I've been in my own private practice for 5 years, I've learned different ways to understand who is the right person, or what do I want for the right person, and how do I find them, and that kind of stuff. So work-life balance is hard if you have Lyme disease or if you're treating it, both of them. I think it's hard.
Right. Especially if you have 7 children. I had no idea. Wow, you hold it all together very well.
Well, my mom helps me a lot. My husband helps me a lot. I wish I was there more with my kids, and I'm trying to, but it gets hard because, I don't want to leave someone that's not feeling good without, actually, making sure they're okay. So, yeah. But my staff now, they've revamped my schedule, multiple times to we actually leave 2 hours at the end of the day for urgent calls because we know that they're going to happen. So, we have we've kind of played with the schedule a lot because now we know that, okay, every day there's going to be like either 2 to 5 urgent issues anyway. So we've revamped our schedule multiple times, trying to have time for me to talk to people, because I was doing it at the end of my day, but then it would be like my day became 8 o'clock. So yeah, so we're working on it. We're trying to like see, okay, this works or that doesn't work. Which the funny thing is that my schedule now is exactly what Dr. Fishman had when I was training with him. Which I was like, I should have just done that. Like I should have just
Why reinvent the wheel? But you
Yeah.
have to learn it yourself. We all do.
Yeah.
So if we jump into Lyme, which is tick-borne illness, some people just refer to it as Lyme, but you can explain what is Lyme and why is it a concern? How much of a concern is it in Maryland and apparently now around the world? We looked a few years ago, where could we move where there wouldn't be a tick that would bite us? And there's not very many places.
Alaska.
Alaska, okay.
The reason that Lyme is a concern is because, like, I mean, really, it's one of our infectious diseases that is ignored and not understood. I mean, most places when they have an infectious disease, they know like, okay, this is the bug and this is the symptoms and this is the treatment. And like if you go overseas, you know, people know, the doctors know like, okay, these are our common infections that are in our environment and these are, you know, common things that we need to treat. And even like parasites, they know like, okay, we need to do a parasite treatment for our patients, you know, 1 or 2 times a year. So they're aware of what the bugs are in their environment, like, you know, which vectors, like the mosquitoes carry this. And so they know all the different infections and they treat it. But for tick-borne infection, there's just been a big disconnect because the ticks, they feed for 24 to 48 hours. They have multiple infections in their hind gut. And when they feed on an animal or even, you know, on a human, whoever they're feeding on, they're transmitting multiple infections. But we're only recognizing, if we recognize it, even Lyme disease, we're not recognizing, but if we recognize it, we're only recognizing one and not that there's multiple infections. And then even when we recognize Lyme disease, we're not recognizing that there's a persister cell or there's a dormant cell that's there. And we're missing like that Lyme is a spirochete, so it burrows into a lot of different tissues. So we're missing the fact that it can actually cause multi-system disease. Like it can affect your joints, it can affect your tendons, but it can also affect your brain, it can affect your heart, it can affect your cognition, it can affect, you know, your GI tract. Every part of your body can be affected, and people are missing it because we are like basically, you know, funneling each patient to their specific complaints. So to the gastroenterologist and the neurologist and the ear, nose, throat, whatever symptom you're having, you're kind of being funneled. But the problem is that we're not looking at the whole picture, and that's because we don't have time. Like we're not sitting and listening, you know, we're not sitting. We have a system where we only have like 15-minute to 30-minute appointments, and most of the time they're 15 minutes. So, and then the Infectious Disease Society, they're not also recognizing that there's a chronic form of the infection, or if there's a chronic form, they're basically saying it's the after effects of infection, meaning that, well, okay, those are going to stay with you. Like your symptoms are not going to get better, but let's do pain meds, let's do anti-inflammatories. But we're following ILADS guidelines, and the ILADS guidelines are saying that no, these are not the after effects of infection. Those are from secondary to the infection. So if we treat the infection, the symptoms clear or improve. And so that's what we see when we treat longer and treat the different co-infections, people have improvement of symptoms. But there is like they have improvement of symptoms, but there's like, if they're not improving, then what's holding them back? And those are like the more, that's where like kind of it gets very confusing or frustrating for patients. So that's where mold comes in, or that's where like more recently, the last year and a half, I've been working on dental cavitation. So yeah, a lot of people, I mean, a lot of people have deep dental infections, and that's where like Lyme mold parasites are hiding. And that's why, like, even if we do IV antibiotics or doing oral, or we're doing every nutritional IV available, but they're not responding, is because that infection has gone into the, jawbone, and it's basically like an ischemic bone disease or a deeper infection that actually needs surgical intervention by like an integrative dentist. So now that I know, like before you, like for mold, I didn't know what questions to ask. Once I figured it out, then I knew how to, how to help the patient find it. And then we didn't, like, even a few years ago, we didn't have a good test. But now we have a good like urine mold mycotoxin test that shows the mold toxin. So a lot of times before it was just like a clinical, based on this, this, and this, there could be mold, and there wasn't a direct test. But we have a more direct test for the patient. Figuring it out in the home is harder. It's not easy.
Right.
Because the mold inspectors are not trained properly. It just goes crazy. Like that part drives me crazy to when I have a positive test, but I can't find out where it is. And the patient's like, mold inspector says there's nothing there. So those are more frustrating.
Right. We're definitely going to circle back to the mold because we have a personal issue with that, personal history. So I wanted to jump back into a couple of things that you mentioned. You mentioned that, can you share the name of the major Lyme? Is that Borrelia or Babesia? Which one? I can't even recall.
Yeah, so for as far as Lyme disease, the Lyme is caused by Borrelia, which is a spirochete. And it's like similar to syphilis, but it's more complex. Its DNA is more complex. It can change in more in the proteins it presents to your immune system. And then what we see, like there's maybe like 14 different co-infections, but the ones we see more commonly are Babesia, which is a malaria-like organism. And then we see Bartonella, which is another bacteria, but it can also be in cat scratches. So those are the ones we see. Also, we're always screening for Rocky Mountain spotted fever because that is actually, that's rickettsia, and that usually can affect the heart. So
one little tiny tick can carry all of these different bacteria.
Rickettsia, Ehrlichia. And so we do screening for a lot of these different infections because people can have more than one. And usually it's rare to have just Lyme disease. You're going to have more than one infection because that's how the ticks have a piercer. And once they pierce your skin, they're usually feed for 24 to 48 hours and then they'll fall off. So the way that their system is designed, they are going to put more than one infection into your body.
Right. So if you were going to design like a public service announcement to keep people from getting Lyme in the first place, what would you say? What would be your advice?
That's going to be tough. That's really going to be tough. But I feel like you definitely should wear like a tick repellent when you're in an area where there can be ticks. I mean, you can literally be walking in grass, but you should do skin checks if you're outdoors a lot. You definitely need to look like under the hairline and areas where ticks can hide. Don't use a tick repellent that has DEET because that's a neurotoxin. So I like Ticks and All, which is a natural essential oil tick repellent. And you can put it on your skin, you can put it on your clothes. If you've been someplace where there's a lot of a wooded area where you think you may have tick exposure, you can put your clothes in the dryer in high heat and it will kill the ticks on your clothes, but you still need the skin checks. If you've traveled, the incubation period is 2 to 4 weeks. So say I went to a park and like 2 weeks later, I have a fever, headache, flu-like symptoms, your degree of suspicion should be high for Lyme disease because sometimes people don't get the symptoms right away, but the people who do get symptoms right away is because this is not their first tick bite. So every subsequent tick bite, your symptoms are going to flood faster because if you have a tick bite that's untreated, that infection's been growing in your system while you didn't know it. And now if you get another tick bite, you're going to have even more symptoms and they may come on faster. So usually like when we have an acute tick bite, we always have to kind of figure out what symptoms are new and were there any older symptoms before? So is it like just an acute and nothing was happening before, or is it a chronic and then now you have an acute? So.
Right. So is the information still the same as when I saw you, that there's a window? How long does the tick have to be on your body to transmit?
The fastest transmission time is 8 hours.
8 hours.
So if you don't know, like if you went out yesterday and today you found the tick, then I usually err on the side of being more proactive earlier because you have a 4-week window. So after 4 weeks, it goes systemic. But you know, if you had a tick bite 2 months ago, it's gonna be easier to treat that than if it was like 2 years ago. So, you know, if you're at a 2-3 month mark, that's still closer to acute than chronic, but after 4 weeks, it becomes more systemic.
Right. So I know my daughter and I both got our, at least my daughter got one of her ticks, and I got the one that I was aware of that caused my symptoms from hiking. So we sort of had an aversion to being outside for a while. And it took me a long time to kind of build my confidence back up because I missed nature and I missed hiking and I wanted to figure out how we could coexist. So, you know, I sprayed my clothes with repellent, not my body, and then would wear those clothes. And then
because you can use permethrin and that's safe. Yeah.
That's what I used on my clothes. And then as soon as I got back, I mean, I would strip, get in the shower and check everything. No chance I was camping because that would be, you know, more than 8 hours before I could check everything under lighting. And so we have figured it out how to hike again. But it's been a process. And personally, as we were in there in your office for my daughter's treatment, when I said, oh, by the way, I found a tick, and you know, it was probably on there for 8 hours because we went hiking in the morning and I didn't find it till the evening. And you mentioned to me that you have this window for treatment, and I didn't want to take antibiotics. I didn't want to, you know, I knew that there were risks with taking antibiotics, and I had already been treating issues with my gut, and I didn't want to trigger any more problems. But I waited and I didn't treat. And then just about right after that window, I started getting joint pain. And so that was my wake up call. Like, my joints didn't used to hurt, and now all of a sudden they are. So I guess I need this treatment too. So that's good advice. Better to treat early rather than late.
I have a lot of herbal protocols now, but depending on what symptoms you had, I usually do a mix of antibiotics and herbals, you know, so especially in the short term and even in the long term. But, you know, but the thing is that if we do good GI support, patients usually do okay. But if people have a lot of GI symptoms that they weren't, you know, they already have them once I see them, then I try to stick to the herbals. But it just depends on like what's going on as to what you're going to need.
Right.
But we also, like in the last few years, like last 2-3 years, we've put together some protocols to kind of heal the damage from Lyme. Like, so we have like a joint protection protocol to heal the joint damage. We have like a collagen protection because a lot of the collagen in your body is damaged from Lyme. We've put together like a cell membrane healing protocol because mold and Lyme really damage your cell membrane. And then we also have, what's my other one? Yeah, an immune protocol. So like, because your Lyme kind of, it makes your immune system such that it's more in Th2 mode and not Th1 mode. So Th1 mode, your immune system, like, it targets intracellular infections, like infections that go into your cell. So Lyme, Babesia, Bartonella, mold, all of these go into your cell. But Th2 mode is more like the other infections like viruses and others. So you have like different immune cells that address different infections, and Lyme, it secretes like different mediators that shift your immune response. So your body's good at fighting a lot of other things, but it misses and it doesn't see Lyme or intracellular infections because it kind of changes the signaling. So your immune system is doing something different.
Yeah. So I have a question that's been ruminating for several years, and I didn't put it on the list of questions that I was going to ask you. I'm going to surprise you with one, but I'm wondering if you know of any connection between how somebody responds to a tick bite based on, no, you said if they have a quick response, it's likely that they've already had an infection. So what about the person that gets the bullseye and gets a fever and gets sick right away, and somebody who doesn't show dramatic symptoms up front? Is there a difference in their immune function, or do we know anything about that at all? Just because I know multiple people who've gotten very sick right away, and it makes it really easy to treat them. With my daughter, who got a tick bite when she was in 3rd grade, I thought she had what looked like a bullseye. When we went to the doctor, they said it wasn't typical. They sort of blew me off as a paranoid mom. They did a quick test in the office and then sent it away, and it came back negative. And they were like, see, you're worried for nothing. It's nothing. But then over the years, she got sicker and sicker and sicker. And each year it was a new symptom. And it wasn't until I think she was in 7th grade by the time we got to see you.
Yeah.
So is there any difference that we know of in the person that responds immediately and the person that doesn't have a dramatic response? Or not so much?
I think there's probably like a lot of different aspects to that, because everybody's medical history is different. You know, how sick you've been, your environmental history, like if you've been living in a moldy environment, or you're going to a school that's moldy, there's so many things. So it's hard to tell. I mean, I don't think we know exactly. I definitely know, like, if you have mold in your environment, you're gonna feel worse faster. You're gonna feel worse faster. But I just want to mention that we do have like a 30-minute acute appointment for tick bites. So parents should take advantage of that, because that's for me to make sure you get on an acute protocol. That's the right protocol. And I listen to you and I kind of give you the lab work. And once you're a patient, then, you know, when you get a tick bite, you can just schedule another talk and I can give you the treatment. So, you know, once you're in our system, you're in our system. But that I made like 4 patients to, you know, a lot of times our offices are very expensive and stuff. So I think that 30-minute visit is like $250. For our patients, if our patients have, we offer payment plans so they can, like, you know, not get overwhelmed by the pricing and everything. But we've made that acute visit for just that reason. You know, if you have a tick bite and it's not being treated, we'd rather it get treated so you don't have the chronic, you know, we don't want to have a chance that there's going to be something more chronic, and address the tick bite, address the co-infections early as soon as we know there's been a tick bite. And then, you know, after that, it's like, okay, we can address a new tick bite, but we're not sitting on some chronic symptoms that can cause a lot of issues, especially for children, but adults too. Like, you know, cognitive function is a big deal, and you won't be able to focus in class or do your work properly, or you know, your memory gets affected, your short-term memory gets affected. So you can have like a few symptoms, but it can be like headaches, brain fog, and fatigue, and, you know, you're basically not functional. So
right. That's a perfect addition that you added to your office, that 30-minute acute appointment. That's great. I'm glad that you mentioned that. And we've both briefly talked about labs. And I know when we were in to see you with my daughter, it was chronic. With me, it was acute. And it was hard to decipher definitively if she had Lyme. You said it was more of a clinical judgment. Mm-hmm. Is that still the case, or do we have improved lab tests that can identify?
There's always a new lab test for Lyme disease. There's always a new test. So like, because I've been practicing 10 years, I kind of like, when I listen to the patients and what's going on, I decide what's the most important test. So for sometimes I'm like, okay, I think I'm worried about mold, and I'll tell them, like, I want you to do this specialty test. Of course, like if I didn't have to worry about anything, then I'd be like, okay, this, these are all the ones I want. But so I have a really good panel at LabCorp, and for most patients that gets covered. So I use that. But IGeneX has good testing. It's not perfect. And that's the thing, like most Lyme testing is not perfect. And that's because the Lyme hides in your immune system. All the tests are not the most sensitive. So they have certain level of specificity and sensitivity. So like IGeneX for Lyme, they're supposed to be 90% sensitive. That being said, like if a patient has been sick for like 5 years plus, their immune system is pretty pounded down, it's not going to show a lot of antibodies. That test looks pretty negative. So a lot of times, like I don't spend extra money doing the specialty labs, and that's just on a case by case basis. So first I do LabCorp, and when I do LabCorp, I'm testing for so many co-infections, and I'm testing for CD57. So I have enough markers that, you know, if Rocky Mountain spotted fever, Brucella, and Babesia show up and Lyme shows nothing, I know like Lyme has to be there. Like it's kind of a, so I throw enough markers out there, and then as we treat, sometimes a negative Babesia test becomes positive because the immune system, when it's doing better, will show up. So even though LabCorp is only 50% sensitive, it's like, I'd rather my patients use the money for supplements and other things that are going to be part of the treatment versus part of the diagnosis. But that's just my way of doing it right now, just because, you know, you have to pick and choose. You have to pick and choose like what is the most best beneficial thing for the patient, and is it, you know, do I really want to test? But if my patient wants a specific, like I really want this test, you know, we have all the kits. We can do them.
Right.
We can do them. Yeah.
Yeah.
And now
always,
that like
go ahead.
now that we have the dental cavitations, I mean, I have a test that I'm really fond of now, like the DNA connections. And this test, when it first came, I'm kind of a little bit slow to adopt testing because I don't like to hop. I don't like to like jump on a bandwagon. So I try to like wait and see. So when that test came out, a lot of people were getting positive tests, and they were getting multiple co-infections and Lyme showing up on there. And I was like, how can that be? Like I have done so many blood tests and so many IGenics, and it doesn't show up, and I didn't understand. But now I understand the reason that it works is because they're home. For a lot of people, like these chronic infections are hiding out under the teeth in that like low oxygen area. So when we do a DNA connections that's like in the mouth, it's so close to their home. And that's why they're all showing up, which before I didn't trust it, but now I'm like, oh, that's why. And I used to always think like, where are they hiding? Like I did all these different medicines and antimicrobials, and where are they hiding? And this is a really good hiding spot, like under your teeth, under root canal teeth, which have no like immune support, the nervous system, like you basically will feel no pain. You're maybe the tooth next to it, you'll feel something, but that tooth doesn't have, the nervous system can't signal if there's a problem, and the immune system can't go there. Once you cut the nerve, you basically handicap that tooth. So I know we're talking about Lyme disease, but please don't get any root canals. You
That's
know,
very interesting. Yep.
and talking about the root cause, I mean, the movie, The Root Cause, you guys should watch it, because once I watched it, there were so many connections there from what I was doing, when I realized that how many of my patients, while I was treating them, were going to the dentist and getting all these procedures and root canals and implants and a lot of things that was affecting their body systemically, and I had no idea. So that is a really good place for Lyme to hide and for mold to hide and continue to affect you. So that's probably the missing link for a lot of the patients who are not getting better. And that's what I figured out. Like, even if I did IV antibiotics, it didn't reach that area, which is surprising, you know,
Right.
but it is very, like, the vascular supply doesn't go there.
Right.
And if it gets into the bone, it doesn't go there. So be very, you know, make sure you guys are going to an integrative dentist. Like, be very careful about, you know, what you have done to your teeth, and don't let, you know, your teeth are really important for your health. And I realize how much now, but like even getting 4 wisdom teeth out is not a good idea, because your body can't heal that. The Dr. Sambatero, who was one of the integrative dentists that I work with, he does not remove 4 wisdom teeth. So like for your families or anyone who's getting a wisdom teeth removed, you only remove 1 wisdom teeth at a time, and tooth at a time. And it's only if it's impacted and getting recurrent infections. You don't just, like, I see so many 16 to 20-year-olds getting all 4 out. And that actually is a hiding place where infections can hide. And as more time passes from when you got your wisdom tooth out, is the longer that infection's been growing and kind of basically setting up shop, you know, and then the infections can go everywhere in your body. So, you know, you have to spread the word that wisdom teeth, we have to be very careful about removing them. Like, I just had mine removed in one that was impacted and it had an infection underneath, but it took him 3 hours and he had to cut the tooth in 3 pieces. So I'm like, okay, so if another person had 4 removed, I'm sure the dentist, they spent 3 hours, but if one took 3 hours, then 4 should have taken at least 8, which nobody does. So I know like that's very traumatic to the mouth, and we have to stop blindly like letting the dentist take them out, because I don't really think that there's 4 teeth in our mouth that shouldn't be there. They're there for a reason, and we have to like, keep our teeth as much as we can, unless they're causing a problem. If they're not causing a problem, they should stay in there. They
Yeah.
shouldn't be coming out.
Yeah. Thank you for bringing that up. It's too late for everybody in our house who already has our wisdom teeth out. But not for my youngest. I have a 9-year-old.
Uh-huh.
We can do differently with him, but I think we might need a whole Wellness Wednesday on focus on the mouth, because
I definitely want to do that, because I'm so concerned about, I see all of these patients who are so sick, and it's because these infections have found a place to hide under the teeth. So
yeah. So I think we could probably talk for hours and hours and hours. And I have, I want to respect your time, especially now that I know you have 7 children. So I want to get to at least a few questions remaining and see if we can finish up by 6 o'clock.
Let me answer your acute Lyme, because I feel like I think that people should know what it is. So some people only get like flu-like symptoms, muscle aches, and fatigue. But if you're getting flu-like symptoms, fatigue, and muscle aches, but then your fatigue just goes, continues, like you had a 2 weeks of fatigue, that's not the flu. This is just not the flu. Okay. If you have like muscle aches, fatigue, joint pains, and headache, that's not the flu. It's just not. Like, it could be if it's just like 1 or 2 days, but if it's continuing and you're getting headaches and night sweats, that's not the flu. Especially like if you have the other, so a lot of times patients are in an environment where they could have got a tick bite and they don't remember, they don't think about it because it's 2 weeks and 4 weeks out. So you need to like remember that, oh, I was at the park, or I did take my dog walking, those kind of things. And the other thing is, because these ticks are not painful, a lot of people don't know that they got bit. And if they bite you like in the back of your leg or on your back and they feed and fall off, you may never see a bullseye. So not everybody gets a bullseye. So your clinical suspicion should be high. And a lot of patients are getting tick bites from their pets. The pets can, and so like if your pets are sleeping in your bed, or even if they're around you, the ticks can hop. So just be kind of err on the side of caution, and keep your radar high, because anyone can get it, and it's better to like not miss it than miss it. So, and when you do testing, for acute, I do the testing in 4 weeks, because you don't really mount an antibody response until 2 to 4 weeks later. So if you test too early, you're going to get a negative test.
Okay. Yeah. Thank you for covering that. You were the one that brought to the attention of my daughter and myself and our whole family that mold could be playing a role in our trouble with healing, and we would get better and worse again. And how is there a connection between mold in the environment and the difficulty healing from the Lyme infections?
So mold is actually like a fungal, having a fungal systemic infection, but mold you inhale through your nose and then it colonizes in your sinuses, and it can in and of itself can cause an entire neurological picture, where you have headaches, dizziness, brain fog, fatigue, joint pains, all of the above. But the other thing that it does is it suppresses your immune system. So if it suppresses your immune system and you have Lyme and other infections, your immune system is not going to be able to clear it. So it kind of like keeps those infections, makes them so much worse. So, a patient who has mold and Lyme is going to be 10 times harder to treat, because usually the problem is that mold is in their environment. So it's either in their home environment or in their work environment, and they're exposed to it for hours and hours every day. So and then the other thing is your furniture gets, whatever you're around is contaminated. So any porous furniture, sofas, mattresses, all these things, like they all have it. So every time you sit on it, the mold spores are getting in the air, and then you're getting re-inoculated. So the tick bites you and leaves. So it's not continuously, whatever it put into your body, but it's not continuously re-delivering toxins, but mold does. And that if you're not out of a moldy environment, it's really hard to get better.
Right. So thank you for bringing that to our attention. It took me like a full year to wrap my head around it. But we finally left that house, and we got the house that we're now living in tested before we moved in to make sure it was a safe place to be. Still, my daughter had to go to get her driver's license and submit all of her documentation. And of course, I didn't throw away her passport, birth certificate, but I had it in a Ziploc bag. And both of us reacted for a full day just from having contact with those papers that had been in the moldy house.
Yeah.
It's crazy.
It's very crazy.
Yeah.
I wish there was like some more being done, but just like iLads is a really good resource for Lyme disease and co-infections. There's a new society that is called, they're called ICEA, the International Society for Environmentally Acquired Illness. And it's basically at least 20 different physicians who are shoemaker certified, who from their clinical experience put together a new protocol to train physicians in treating mold toxicity. So they have a lot of resources on their website, and they have a certification program that's not shoemaker. They're shoemaker certified physicians, but they've made a new put together like a consensus for what treatments work, what's the best approach, what testing is the best, how do we find the right mold inspector, all of these things. So their webpage has a lot of good resources for you guys.
And the acronym was ICAI.
Yeah, it's ISEA, International Society for Environmentally Acquired Illness, AI.
Okay. And then iLads is another organization that people can use as for support with Lyme treatment or Lyme information, Lyme education.
Yeah, so iLads actually passed a guideline for treatment for chronic Lyme, and that was passed, I think, in 2009. So, and that's in the National Clearinghouse for, treatment guidelines, because, any treatment guideline, like when you're like a cardiovascular treatment guideline, or like ear, nose, throat, or GI, they get published and accepted. So iLads has a new guideline that was published and accepted, and you can find it on their website. And we're following that guideline. And I also you probably know about that book, but there's two books that are there's probably three books that I recommend. One is Why Can't I Get Better by Dr. Richard Horowitz. And he, has so much medical documentation and literature about the infections, and a lot of the information that's already been researched that people are not looking at. But none of the treatment we do doesn't have a medical article or literature or studies behind it. So that book is a really good resource to just if you're looking for symptoms or answers. And then for mold toxicity, Dr. Neil Nathan, he wrote Toxic, and that, I follow his protocol and the ICEA guidelines, but that book is really good in explaining mold toxicity and its effects. And then more recently, I for the dental cavitations, the Toxic Tooth and Hidden Epidemics is really, really good in explaining all these like different chronic dental infections and how they cause chronic illnesses in your body.
Okay. Fantastic. Thank you for sharing all of
Those
that.
are like good gifts, like give them in the holidays. And just...
Oh my goodness. You are a wealth of information, but you have to go home and eat dinner with your children. So how can people find you if they want your services?
So basically we've made it very easy. So our website, there's a little like messaging bar where you can say like I'm looking for information, or I want to be a patient. You can also just like, if you are referring or your friend is referring or someone wants to be scheduled or has questions, you can text our main number, which is the 301-970-9724. You can send text to that number, and my staff, and I see all those messages and my staff sees those messages. So you can, you don't have to do the website if it's too hard for you or you're too tired. And even for our patients, we've kind of made that a second way for them to let us know, hey, I'm not feeling good. So if it's too hard to get on the patient portal, but so we have multiple ways that you can get in touch with us. So on the website, if that's easier for you, or you can text the phone number and then one of my staff will get back to you.
Can you share the website with us?
Yeah, it's www.BeTheChange healthandwellnesscenter.com.
Wonderful. Thank you so very, very much for sharing your wisdom, your knowledge, your time. It's been great to see you again, even though it's on Zoom. Yeah, so I hope we get to do this again. And I'm so glad that you're doing well and you have 2 grandchildren now. And I hope you get some mommy and grandmom time and a little break from the office, because I know you need that too.
Thanks. Yeah, I'm trying to balance it, but yeah. Oh, I want to also answer this one question that you had on here, the brain health and wellness perspective, how Lyme and mold impact someone neurologically. So I think that everyone should be really, really aware of this, that Lyme and mold and even those dental cavitations can cause a lot of brain fog, memory issues, cognitive issues. So, don't just let people label it dementia, because it could be a toxin that you can solve. There are also a lot of our elderly have heavy metal mercury fillings, which can cause a lot of brain fog and cognitive dysfunction, because now they don't do the mercury amalgams, but they did them in the 80s and 90s. So a lot of our senior citizens, or people who are in their 40s, they've probably gotten some metal fillings and they don't know. I mean, they're not everyone's told that they're not good. So look beyond just like the cognitive dysfunction to what other things could be there. And at the same time, we do have like hyperbaric oxygen, which I was talking about. It's it gets pressurized oxygen to all the tissues, but the brain. So, be proactive about your brain. You can do hyperbaric oxygen. You definitely should do it if you've gotten in a car accident, you've had a concussion, you've had a head injury, you've been exposed to mold, because it's going to heal the damage that you can't see in your brain. It's going to decrease the inflammation, and hopefully like we can prevent like dementia as a later effect, and it's really easy. You just lay in the chamber for 2 hours. Even these dental infections, like healing from surgeries, like I went in my chamber after the dental infection, and I had a lot of pain, but then it calmed down, and I know like it was getting oxygen to those tissues and healing. So it's a really easy treatment that people don't know about. Even lung inflammation, like when people had COVID, it does decrease it. There was a lot of studies about that, but now I can't find them, but I know that it does. I know that it does. So it's something that more people should know, because our kids are in school and they get concussions and everybody just says to rest, but that actually, like, multiple concussions can actually make even a tick bite worse, because if you have like 3 concussions and you get a tick bite, you're going to have a lot of neurological symptoms. So once a child or even an adult gets a head injury, they should really do hyperbaric, because that's going to heal the damage from those injuries, and then hopefully make it that down the line your brain health is better.
Yeah. Do you use the hyperbaric oxygen as like an a la carte service, or does someone have to come in and be a patient?
Well, all of our services can be a la carte, like the adjunct services. Sometimes I just like do a 15-minute talk or screening to kind of see what's going on and what are you doing. But yeah, I like for our hyperbaric and even our IVs, we've made the prices more affordable. So the hyperbaric, you should do like 10 sessions usually, which means like 10 hours, but each hour is $50. I've made it, like most places they charge 75 to 100, but I've made it more affordable so that people use my hyperbaric versus it just sits there. So
right.
So I made it accessible and not as expensive, so that people can do multiple treatments.
Yeah, that's fantastic. Thank you for jumping back to that question, because that's my mission, to prevent dementia and help people with brain wellness. And you hit on some really big topics of the Lyme and the mold and the dental issues. So,
and one other thing, I don't know if I was doing this when you were a patient, but One of the ILADS conferences, there was Dr. Gedrick. She's a rheumatologist, but she treats Lyme. And she was saying, like, are we treating Lyme or the after effects of Lyme? Because all of these infections that are intracellular, they feed on this fat in our cell membrane called phosphatidylcholine. And if you've been sick for a long time, or you've been in a moldy environment for a long time, your phosphatidylcholine is depleted. And all of those cells that the infections went into, they have basically, holes punched into the cell membrane. So it's easier for infections and toxins to get into the cells. And that's not just like one cell, it's like millions or billions of cells. So as soon as I started using like phosphatidylcholine orally and then the IV form is when my patients were able to like come off of their medicines and being on continued medicines and stuff like that. So the IV phosphatidylcholine is a really, really good neurological support, and it heals a lot of damage to your cell membranes. But those are cell membranes like in your joints, in your brain, in your heart, like wherever there is. So, like I look at it like termites and structural damage. Like if I get rid of the termites, which is like your infections, I still have the structural damage. And if I don't heal that, that's always going to be a weak area that can come back, or the infections can get to that areas because they know like, hey, I already like made my dent, I know how to get in. So instead of just treat, we've kind of healed some of the structural damage so that our patients don't have to continue to treat, because even dementia can be like, you don't have enough phosphatidylcholine, so those are some of the different things. Like mold also depletes phosphatidylcholine, and like any infections that are going into the cell, they basically feed on that fat for energy, but then they punch a hole in the cell. That's how they get in. So, and I sat in her lecture and I was like, did she say this like the last so many times that I was in her lecture and I didn't understand? Or is it because now I've done all these things and what she said makes sense, because I go to her lecture every time and it never really, and I don't know if I didn't understand it or I wasn't at those, I wasn't at a level where I could understand it. But once she said that and I was thinking about it, then I was like, oh, it makes sense.
Right.
So we have those IVs in the office, and there used to be a doctor, Dr. Patricia Kane, and she did this like membrane protocol, and it's basically about phosphatidylcholine, but she hasn't done her conferences, but there's other people who still like train phosphatidylcholine infusions and how to do them, but it's a missing link, like how mold was a missing link.
Right.
Phosphatidylcholine is a missing link, but the people who don't do well on phosphatidylcholine are the ones that we found out are the ones who are still in a moldy environment, because it detoxes them too much. So they tend to feel worse after PC. So I usually have patients do some binders to bind mold toxins out for a couple of months and then do PC, because like the phosphatidylcholine IV, because otherwise if you do it too soon, people feel bad and they think like, oh, that made me feel sick. So
yeah, I believe it was Dana Lake, who I interviewed on a Wellness Wednesday, who was my nutritionist years ago when I first got diagnosed with MS, who gave me phosphatidylcholine as one of my early supplements, and I hated it. It tasted terrible. So I'm glad to know that you can get it IV. I think that would be my preference. Yeah.
You can hide it in a smoothie.
Okay. Oh, so thank you so much again, especially for that extra time that you've given us tonight. And I hope to be in touch again soon.
Okay, yeah, do a tooth wellness because it's my hot topic right now.
Yeah,
okay?
Awesome. Okay, let's do it. Okay, thank you, Dr. Afrooz.